This is Bob Byrnes, Mayor of the City of Marshall, with another in our series of updates on the COVID-19 response in the City of Marshall. With me today again is Dr. Steve Meister. Dr. Meister is Chief Medical Officer at Avera Marshall and also a member of the Marshall City Council. Today, we're going to give just a short update on the current situation. As we all know, late last week, the governor did revise a number of his directives regarding the business operations, including city operations, in response to the current pandemic. So, as a result of that, early last week, we did see some limited openings, outdoor dining, hair salons, and that type of thing that are open. And then this week, we would expect that some other activities will be able to be open midweek, and that would include limited inside dining, some additional openings of some businesses and activities and gyms and that type of thing. So, of course, there's more details on that. All of this really means that number one, we want to be safe, but we also recognize, and the governor's office recognizes that our economy needs to continue to go, and businesses do need to open. I will say that we should commend our businesses on their operations. They've implemented protocols that are really designed to keep their employees safe as well as their customers safe. They have a number of things in place, whether it's a restaurant or a hair salon, that is all new and designed to keep everybody safe. So thank you to all of the businesses. I would expect that we will continue to see more of that as additional businesses do open. This also puts the responsibility on us as the general population, as us as customers, to continue to do what we've been doing for the past several months: maintain social distancing and wear masks, stay home if you can, especially if you're not feeling well. All in an attempt to not only keep ourselves safe, but to protect the most vulnerable in our community. As we know, there has been an increase in the reported number of cases, and that is likely from a number of factors, including the increased availability of testing. And Dr. Meister will talk more about that. But as of today, and it is June the 8th in the mid-afternoon, we know of no one hotspot in the community. There's no one source of employment in the community that is impacted more than others. There's no one part of the population, either age or gender or race or ethnicity, that is affected more than another, as the information that we have at this point. I'm going to turn to Dr. Meister, and he'll give some additional medical details, and then I'll come back and talk about some additional city operations, including the planned opening of the aquatic center. Steve?
Thank you, Mayor Byrnes. So as you had said, we are seeing an increase in positive cases. And as you alluded to, we have lots of reasons for that. So the first is that there is increased community spread. We know that this virus, as we've said multiple times, is community spread. It's contagious. It's extremely contagious. And so naturally, as people are getting, I'm going to use the phrase COVID-19 fatigue, and maybe letting their laurels down as far as safety and personal protective equipment, masking and things like that, more people are being exposed. So that is one reason that we're seeing more. And we've always said that it's probably here, we just hadn't tested it. So as you alluded to, testing has been expanded. More people are getting tested. With increased tests performed, number of positives goes up, and to the best of our knowledge, the growth in positives has been associated with symptomatic patients, not yet due to increased testing of asymptomatic people as yet. But we know that people are asymptomatic oftentimes for a while and shedding the virus. So as testing gets further expanded, and we anticipate that it will, and asymptomatic people get tested, I anticipate that those numbers will start turning positive too. And again, like I spoke to it before, some of the increased rates are because the safeguards we've had have been kind of relaxed a little bit. The governor has allowed for more things to be open. That's great for the economy, but with the right of having that openness and communication and commerce again, it's the responsibility to take care of ourselves and to protect each other. So again, hand washing. Wash your hands 5 times a day. It's been shown in a couple of studies that when you wash your hands frequently and appropriately, viruses and spread of not only coronavirus or COVID virus, but the viruses that cause the common colds, the common flus, food poisoning, bacteria things, those all drop down significantly. Again, if you don't feel well, stay home. Wear a mask. There's a lot of people saying, well, it's my right not to wear a mask. Again, nobody's going to argue that. It is your right. However, we don't wear the mask to protect us from others. We wear the mask to protect others from us, meaning if I am an asymptomatic carrier of COVID-19 and I were at a city council meeting seated next to Mayor Byrnes, which I am within 6 feet of him normally in our meetings, I would wear the mask to prevent Mayor Byrnes from getting what I have as we speak. Likewise, Mayor Byrnes, if he is an asymptomatic carrier, would be wearing his mask to try to prevent me from catching what he's got. So when you wear your masks and you keep that 6 foot space, and particularly the 6 foot is important for, you don't want to be within that 6 foot window for more than 10 to 15 minutes. If you're there less than 10 minutes, less than 15 minutes to be sure, you are okay. If you're outside the 6 foot window for a long time, you're going to be okay for the most part. But again, the only way to prevent it completely is to bubble ourselves, and we don't want to do that. The hot spots, yeah, Marshall and Lyon County, we have 144 cases as of today. Lincoln County has 6. Rock County has 23. Lincoln County, like I said, has 6. Murray County has 41. Yellow Medicine County has 52, and Lackaparle County has 3. This is important because people are saying we are a hotspot. Well, I don't know what defines a hotspot. That's determined by the Minnesota Department of Health. They have not labeled Lyon County or any particular business or group in Marshall or Lyon County as a hotspot either. So again, we are seeing an increased number, but this again makes sense. We're the biggest county in that 4-state area. Lincoln County, we're bigger than them as far as population. Pipestone County, I believe we're bigger than them as far as population, and Murray County, we're bigger than them. So most of the people in the Southwest Minnesota live in the 2 biggest counties population-wise are Lyon County, I believe, and Nobles County, and we have the biggest share. I said misstated before. I said Yellow Medicine had 3. Yellow Medicine actually has 7. It's Lackaparle that has 3. Chippewa County has 52, and that's of today's numbers on the Minnesota Department of Health website. People have asked us, and me specifically, where are all these people coming from? And, we know when people go through to be tested, that is private information. I can't tell anybody who's being tested anything, just like you would not want your medical information to be released. I cannot, nor will I, nor will anybody else in the medical field release that information. That's the patient's story to tell. And it's protected by state and federal law. So even if we wanted to tell you, we couldn't. Like I said, a patient who is positive, if they so choose, it's their story to tell. They can tell whomever they want. If businesses have employees who are affected and they have permission from the employees, because again, private health information is exactly that. Not even an employer can get it. But if the employee who may have COVID or it has tested positive lets his employer know, and they work in collaboration with public health, they can do that too. But again, a healthcare organization would not ever disclose test results or details of where positive cases occur. Keep this in mind. And also keep in mind that, again, this disease is contagious. It doesn't care the race, the gender, where you work. We all have to do our part to protect our community and safeguard the health of the vulnerable. And it's important for us all to do that. Um, testing, uh, as more testing supplies have become available and as more capacity has been created in labs to run these tests, the testing criteria has expanded. The Minnesota Department of Health recommends testing for symptomatic people. So again, the cough, the cold, the fever, the achiness, particularly if any of those are associated with loss of taste or loss of smell. If nursing homes, we are testing our nursing home patients. So people in congregate settings, staff working in those areas, cluster investigations. So if there's a big group of people who are all socially associated, meaning they're all from one employer or they're one group. Um, there was a place down south, I believe it was in Georgia or one of the southern states, where people were in a church and they got it. Those kind of people are being recommended to get tests despite being asymptomatic. Doctors, nurses, lab workers, anybody who works in the hospital, those people are getting tested if they desire. And then the biggest thing that has to do with the events of last week, unfortunately, is that testing is also now recommended for people who participated in large gatherings like the protests or community cleanups after the protests or vigils. We haven't had to do any cleanup in Lyon County, thank goodness, and I hope that we don't have to do that with the protests going on with Mr. George Floyd and the situations going there. But we did entertain a few protests in the city of Marshall, and that was rejuvenating to see that everybody was protesting peacefully the way that it's intended and the way that good communities do. But I also saw that there was a lot of people not wearing their masks, and they were certainly well within the 6 feet bubble of each other and probably for more than 15 minutes. So again, you got to balance these things. So if you feel sick, stay home. Call the 877 at Avera. If you were in one of those protests and feel sick, yeah, call the 877 at Avera. Let people know that you were doing that and tell them that, the governor has recommended that we do test people. Now, the difference between those tests and the test for a symptomatic person who comes into the hospital is where those tests are processed. So we collect the tests here at Avera Marshall, and some of the other Avera facilities are also collecting those tests, but they're processed differently. So if a patient comes in, has symptoms, needs to be hospitalized, we process those tests in our own lab. If you were at the protest last week and are worried about it and get tested, the test is collected here, but that test actually goes to Mayo Clinic through the Minnesota Department of Health, and it gets run there. So the turnaround time from ours is anywhere between 45 minutes and 2 days, depending on the process that we use. But for the asymptomatic, low risk people and the people who are in gatherings, we would recommend that those tests can take up to 7 days. Probably not, more on the order of 3 is what we've been experiencing, but they can take up to 7 days. So those are the things that are up for now as far as testing. Now, the one thing that people have heard a lot about is antibody testing. I'm getting a lot of questions, Mayor Byrnes, about people saying, well, I was really sick back in February and I could have sworn, I had somebody who was in California or Washington, or we had somebody who was really coughing and looked really sick, and we were in Chicago airport and that person had just gotten off a plane from China. I think I might have had it. Well, that's called antibody testing. And antibody testing will be coming online shortly. It's not ready yet. We will let you know when that's ready. But that test will be done, and that test tells you whether you had the antibodies or not. Now, I want to warn people that this is a screening tool. It'll tell you the Avera test is showing good promise as being fairly specific um, about COVID-19. The thing that it doesn't tell us is if you have immunity to that. We don't know that. That answer is yet to be that question is yet to be answered. So the question would be, I have antibodies, I had COVID, am I immune from catching it again? The answer is, I don't know. And we don't know as a scientific community, so we have to be careful. This does show, if you're interested in donating convalescent serum, that if you had COVID-19 and you recovered, we may want your serum to spend to give to people who are really sick with COVID in the hospital. There is studies going on in that, and so those would be organized through Red Cross and the Avera McKinnon laboratory as far as donation, and we'll deal with that in the future when we know that we have that test available. So that's my update for today, Mayor Byrnes. I'm turning it back to you.
Thank you, Dr. Meister. And as Dr. Meister indicated, we do not see any one business or employer in the community that is pausing because of cases in their employment. In fact, all of the businesses and employers are really doing a nice job and really trying to protect their employees and ensure the continuity of their operations. Now, in terms of city operations, in last week's governor's order, on one of the areas that was opened up to a degree are aquatic centers and swimming pools. And the Marshall Aquatic Center, we are planning to open that by Father's Day weekend. There's a number of things that need to be done and put in place to get that up and running, to get it filled with water, get it clean, get staff in place, and that does take some time. So we're planning that by Father's Day weekend that it would be open. Our staff will put into place protocols that will be publicized hopefully early next week in terms of how that operation is going to go. There will be limitations on the size of the gatherings there. So it'll be less than the governor's order of 50%. There will also likely will be some shifts and times and extended hours and that type of thing, and distancing with the furniture there. So all those details should come next week, and we would anticipate that, barring something unforeseen, that it will open by Father's Day weekend. In terms of the end of the aquatic center's season, which has typically been right about around the time that perhaps the state fair starts, normally the we are looking at perhaps extending that till the end of August or perhaps even to Labor Day, but that really does hinge on labor availability as well as weather. So we recognize that the aquatic center is important for, family activities and healthy family activities. We do expect from the Minnesota Department of Health additional guidance on other outdoor recreational activities by early July, including ball and organized games. So we expect more information that will be coming out on that. So again, thank you to the community. Thank you, Dr. Meister, for your expertise, as well as all of our Avera staff here in the community. If anyone has questions, medical questions, again, call the Avera number. City questions, call the City of Marshall number. We wish you all a good day and stay healthy, stay safe. This is Bob Byrnes, Mayor of the City of Marshall.